Hantavirus is a zoonotic disease, meaning it lives in wild animals. Humans only catch it by directly inhaling dust contaminated with the urine, saliva, or droppings of infected rodents. That environmental requirement didn't align with the environment on the MV Hondius. Every confirmed case required a wild rodent host, but there were no nests or mice in the passenger cabins. The events on the MV Hondius contradicted decades of established medical consensus. The pathogen spreading through the ship's corridors was bypassing its natural animal host entirely, forcing virologists to confront a terrifying evolution of the disease. To understand the anomaly on the ship, we must look at how this virus traditionally operates. Medicine first recorded it in the early 1950s, when thousands of United Nations soldiers in the Korean War developed unexplained fevers and massive kidney failure. Decades later, researchers traced that specific illness to a virus carried by local field mice. The disease remained primarily associated with kidney damage until May 1993, when a cluster of young, completely healthy adults in the American Southwest suddenly began dying of acute respiratory failure. The virus was attacking the body differently. Investigators realized the region had just experienced heavy El Niño rains, producing a massive harvest of piñon nuts. The abundance of food triggered a surge in the deer mouse population, creating a spike in the virus circulating in the local environment. Scientists identified a new viral branch during this outbreak, naming it the Sin Nombre strain. It was responsible for a distinct, highly lethal condition categorized as Hantavirus pulmonary syndrome, or HPS. In patients with HPS, the human immune system recognizes the virus and completely overreacts. The inflammatory response is so aggressive that it causes blood vessels in the lungs to leak, rapidly filling the air sacs with plasma. The patient effectively drowns from the inside out. By the late 1990s, the scientific community had a firm grasp on the rules of hantavirus. It was exceptionally deadly, but it was strictly an environmental hazard. If you avoided breathing in the dust from a rodent's nest, you were safe. In 1996, an outbreak in southern Argentina began to behave differently. Healthcare workers and family members started contracting the virus, despite having no contact with rodents. Their only shared exposure was treating the infected patients. This family tree shows the virus's genetic breakdown. Splitting off is the Andes strain, the only one capable of human-to-human transmission. But it has strict biological limits, requiring close, prolonged physical contact to jump between hosts, usually limited to household members or caregivers. The unique properties of the Andes strain track back to a Dutch couple on the ship. Before boarding, they had visited a birdwatching site near a landfill in Ushuaia that was heavily infested with local rodents. They inhaled dust contaminated with the Andes strain and then boarded the cruise ship. Medical research shows the Andes virus has a narrow window for spreading between humans, often peaking for just a single day during the early phase of the illness. The couple spent that infectious window socializing in the tight, enclosed environment of the ship. The Hondius outbreak required a precise, tragic alignment of factors. A rare viral outlier met a perfect timeline, becoming a lethal vector. Because the Andes strain demands such intimate physical proximity to spread, a global airborne pandemic is highly unlikely. Once the Spanish government allowed the ship to dock in the Canary Islands, health officials successfully isolated the patients and contained the spread. However, the clinical reality for the individuals who actually catch the virus is grim. Acute infections require intensive care, ventilators, and extreme pharmacological support just to keep the patient's blood pressure stable. And surviving that acute phase is merely the first hurdle. Longitudinal studies of hantavirus survivors reveal deep, lasting physiological scars. Even 5 years later, patients report extreme fatigue, severe muscle aches, and drastically decreased exercise capacity. Many also develop proteinuria, a progressive condition where protein leaks into the urine, signaling long-term kidney damage. For the general public, the highest statistical danger doesn't come from exotic cruise ships or South American landfills. The real threat lies in common domestic spaces across the Americas, Europe, and Asia. Closed-up garages, dusty storage sheds, and rustic tent cabins act as incubation chambers for rodent droppings. If you find evidence of rodents in an enclosed space, the absolute most important rule of prevention is never sweep and never vacuum dry droppings. The mechanical sweeping force immediately kicks the lethal microscopic viral particles directly up into the air that you breathe. Instead, you must open all doors and windows to ventilate the area for at least 30 minutes. Wear a mask and rubber gloves. Spray the entire contaminated area heavily with a 10% bleach solution. Let it soak for 5 minutes to kill the virus, and then safely wipe it up with damp paper towels. While mutated strains on cruise ships will capture international headlines, Hantavirus remains a primarily silent environmental killer. Your best defense against it is awareness